The first point I'd like to make is both the extent of drug-resistant tuberculosis and our failure to reach people to even treat them for drug-resistant tuberculosis. So if we estimate that close to 500,000 people might have multi-drug-resistant tuberculosis in the world, we're probably only diagnosing a third of those, and maybe only a quarter of those actually get treatment. That would be okay if the treatment they received was actually effective and tolerable. But even of those quarter of the patients who have drug-resistant tuberculosis who are treated, they don't do very well. Maybe half of them end up being successfully treated. What's worse is the treatment that they're undertaking is toxic, grueling, up to 24 months. And for me, the most striking story is the fact that many go deaf. In some sites, 30, 40% of patients who are treated for drug-resistant tuberculosis with the current regimens end up losing their hearing. What's even more shocking to me, in some sites, when someone starts to lose their hearing, they don't stop the treatment. They fit them with a hearing aid and continue the treatment because the choice is deaf or deaf. And we don't think that should be a choice for patients with drug-resistant tuberculosis. So we're undertaking various research initiatives to address this in the Union, and I'm going to speak briefly about a clinical trial called STREAM, which is a USAID-funded trial that the Union is sponsoring, working with the Medical Research Council of the UK. And we're currently in 4 countries comparing a shortened regimen for drug-resistant tuberculosis, which is just 9 months, to the current WHO recommended regimen. This is in 4 countries. We're currently at 350 of the 400 required patients in the study, and we hope down the road that is going to give some important information. We're also in the early stages of planning an expansion of this research that is also very exciting, that we hope we'll be testing 2 additional regimens that may actually remove the injectable component from treatment and make treatment, hopefully, more tolerable for patients. So I'll pass on to my colleague, Dr. Tribute.